Hi students, how are you? Welcome back to another video. In this video, we're gonna solve a case study. What would you do if? The question is, a group A patient needs blood, means RBCs and FFP, fresh frozen plasma. A small rural area is out of both group A blood and group A FFP. Which of the following would be your choice to transfuse to this patient? First of all, let's take a look on blood group A. Means what blood group A person have. On the surface of RBCs, group A patient have A antigen and in its plasma it have B antibodies. It means you must transfuse RBCs that lack B antigens and you must transfuse plasma that lack anti-A, because as you know, you must transfuse RBCs that lack the antigens corresponding to patient antibodies and transfuse plasma that lacks antibodies corresponding to the patient antigens. Now things are clear what we have to keep in mind while looking the given options. You have to find an option that RBC lack B antigen and plasma that lack A antibodies. Now take a look of these four options one by one. In option A, RBC of group AB and plasma is also of group AB. It means RBCs have both A plus B antigens on its RBC surface, and it don't have anti-A plus anti-B. In this scenario, patient anti-B would react with AB cells. So that's why this option is incorrect. In option B, the blood group of AB RBCs and group O plasma. As I described earlier, we can't transfuse RBC of AB to patient blood group A. Now let's discuss about plasma of group O. In plasma of group O, there is both anti-A plus anti-B. So anti-A in the O plasma would react with patient's RBC. It would react with patient RBC. So that's why this option is also incorrect. Now let's take a look at option C. RBC is of group O and plasma is of group AB. You could give group O RBC because group O person don't have antigen A plus antigen B. It doesn't have A and B antigens on its RBC surface, so it won't react. With patient's anti-B. A person with group AB doesn't have plasma AB doesn't have anti-A plus anti-B in their plasma. So it doesn't have anti-A. To react with patient RBCs. So that's why this option is correct. In option D, RBC is of group O and plasma is also of group O. We have discussed that why plasma is group O is incompatible for group A patient. In this option we have already discussed. So that's all for today's lecture. I hope this lecture will be helpful for you. Thank you. And don't forget to like, share and subscribe my channel for more videos. Thank you.